Can you hear me? How about that? You guys are going to fall over. I was on time. It's funny, I started back a couple different places lecturing again now. They're letting me back. And place I used to get a lot of people, there were only two. And the lady, after I was done, she said, Dr. Coppola, we don't want you to come for just two patients. I said, I go and talk to myself. It's no big deal at all. You know what I mean? It's just, the whole idea is getting information out, guys. And what's today's topic?
Fatty liver disease. May I ask you a question before you get started?
Sure.
What hospital do you work at?
I'm on staff at AGA, Passavant, and Swickley, Heritage Valley, and Kennedy Heritage Valley. The only place I round today is Heritage Valley, Kennedy.
Okay,
Yeah.
because when I went down, I had an appointment with you, and Darlene told me that you were at the hospital.
Yeah, I was stuck over there this morning. That's why I'm early. Because usually what I try to do is do clinic, run over there, and run back. See? I was early, guys. Make note of that. Make note of that. All right, first and foremost, show of hand. Who's heard of fatty liver disease? Okay? Why I picked this topic is why everything happens to me. When I have a patient and it takes me down a rabbit hole, I'm amazed. I'm just amazed. And the one thing I'll tell you right now, that if it doesn't get attention to you, you won't understand what I'm going to talk about. The number one reason for liver transplants in America is fatty liver disease. I used to work for the Pittsburgh transplant. I did that while I was going from medical school into residency. And I'm amazed is all I can tell you guys. The number one reason for liver transplant is fatty liver disease. And so that got me thinking that I'll at least track down some of the information. And as I did, I was shocked. In fact, so shocked. And I know I always say that Karen will do this. I'm going to write this stuff up here, and then what I'll do is have her look right off of this, because she'll give me a reason why she doesn't do it. But there's two articles. One's from the Mayo Clinic, and one's from the Cleveland Clinic, and I would hope everybody would agree those are competent sources. We've had the knowledge of this since 1983. That's 40 years, guys. And when I show you the data, you're not going to believe it. Pre-1983, childhood diabetes was type 1. What that means is you get the bad amino acid in your in your system to develop your proteins. So type 1, you get usually as a, say, 10 to 15-year-old. And then all your life you have to take insulin because of a error in your body's genetic makeup, okay? That's type 1 diabetes. That's all we saw. Does everybody understand me? 1983, yes, there was diabetes in children, but it came from a genetic mutation, not from something we ate or drank. And now today, I'll show you, wait till you see this, it's unbelievable, guys. And they know it goes to children. That's the part that bothers me more than anything. So what we're going to do is develop the physiology and pathology for liver disease, specifically fatty liver disease, and then we're going to go through a series of understanding how the body functions and what exactly happens with the fructose corn syrup. And then I challenge everybody to go home today and look in their refrigerator, because everybody in this room thinks there's no fructose corn syrup in anything they have in their refrigerator. And I did that with my wife.
Over in the, where the ice cream machine is, they have Hershey syrup and also caramel syrup, and they
Both have fructose. Well, my wife said, I don't have any. So we have one of those, like the doors open up. Every single salad dressing, fructose corn syrup. Ketchup, fructose corn syrup. All the, like, you know, you grill outside, so all the sauces you put on, every single one of them, fructose corn syrup. All sodas, fructose corn syrup. All cereals, fructose corn syrup. And the saddest part about it is that to get the fructose corn syrup, obviously because it says corn in it, the corn's all genetically modified. Does everybody follow me? And you're gonna read these articles, guys. The one from the Cleveland Clinic says the dangers. Imagine that, putting dangers in the topic, in the heading of your article. The dangers of fructose corn syrup. So they spell it out right at the beginning that it's dangerous. And again, this first article was from September of 2020. And it did such a nice review. That's why I want everybody, I'll put all the information on here at the end so that everybody checks it. You know, just go down and Google it and you'll get the information. These are two reputable institutions that have done the deep dive on the fructose corn syrup. And now there's no doubt at all, it is dangerous. And that's what we're gonna run through, okay? So please understand, I get these thoughts for topics based upon what I see in my practice. And it's remarkable. And let me say this, depending upon how far along the fructose corn syrup is, I have many, and when I say many, over 50 patients that don't have any fat on their liver anymore. And the one thing every single one of them did, stopped fructose corn syrup. And then I quote Hippocrates. What did he say the best medicine for men is? Walking. You can burn it off. So those are two factors to understand. It's not necessarily going to take your life as long as you're willing to change what you're doing. And all you got to do is look at the label. If it says fructose corn syrup, don't take it in. And by doing that and getting walking in or some exercise, you can get rid of all the fat in your liver. Does everybody understand the concept? So this isn't doom and gloom at the very end, but you got to pay attention to it. And those of you that think there's no fructose corn syrup in your home or your house or where, look at canned goods too. Look at beer. That's the one that blew me away. If you guys paid attention, it was the last Steelers Super Bowl. It was in 2010. They brought up, it was all the beer commercials, and they go, hey, we got your fructose corn syrup. And I forget what beer it was, but they proudly pronounced that they don't have fructose corn syrup in their beer. But majority of beer has it. The article that you'll read, if you take a look at it from the Mayo Clinic, 600,000 products that are on the shelves in every store today have dangerous levels of fructose corn, 600,000. And to me, that's what made me think about, we have to talk about it because it's dangerous. As you're gonna see, it causes cancer. As you're gonna see, it causes heart disease. As you're gonna see, it's causing dialysis in children. That to me should be enough that everybody wake up. And the fact that these major centers are writing articles about it, but no one's doing anything about it. That's the part that's upsetting to me. All right, so let's understand the physiology first. All right? This is Joe. And when Joe eats, all the food goes down the esophagus, into the stomach. This is the liver over here. And remember, we'll put dots. The pancreas sits right here. And the pancreas and the liver secrete into what's called the duodenum, which is right there. And then we have about 150 feet of small intestine. I always say we go out to George and back, okay, at least. And then from there, over on the right side, we get the beginning of the colon marked by the appendix. And so the colon comes up, over, down, and the sigmoid goes out to the rectum, all right? So this is, for all practical purposes, all you need to understand for what we call digestion, okay? I'll put it up there, digestion. So you eat the food. If we chew it 32 times, the enzymes in your mouth already begin to digest the food. All right, I don't want anybody to raise their hand because I don't want to embarrass anybody. But please chew your food at least 20 times. Try it. you'll see the enzymes begin to work in your mouth. So the enzymes, if you're chewing 32 times, begin to break down the food. The esophagus, all it does is pass it down to the stomach. In the stomach, hydrochloric acid starts to break down all the food, and as it makes its way, the liver secretes bile, and the pancreas secretes enzymes and other ingredients to help digest the food. From there, we go right to the small intestine, and all it does is absorb and pass along the food. Absorb, pass along the food, okay? So what happens before the food makes its way to the colon for the waste, everything goes through what's called the portal vein. And the portal vein takes everything, I'll put it this way, portal vein. Everything that we've eaten in the small intestine decides is worth keeping, sends everything to the liver. Does everybody understand that? So 100% of what you eat that your small intestine deems that you want to keep for your metabolic purposes of energy goes through the liver, through the portal vein. Everything. So it comes to the liver. Once in the liver, what does the liver do? Okay, let's draw it this way. We're going to draw just to get the concept down. This is the liver. Portal vein brings everything in. And the liver takes all that you've eaten and converts it to carbon, oxygen, hydrogen, and nitrogen. So it breaks down fats, breaks down carbohydrates, it breaks down protein. And then once it breaks it down, it builds it back up and sends it out into the bloodstream. So it detoxifies and it also enhances. What does that mean? Well, that means that if you bring something into your system that you want to go through your whole body, protein carries it there. So the liver binds it to a protein and sends it out. All right? So in general, everything gets broken down. So we'll say broken down and then rebuilt. And with the ideal diet and activity, we're all supposed to say slim and trim. Of course, not like me. All right? But what you have to understand is that's how the body functions. So we eat, chew 32 times so the enzymes in your mouth work, make its way down to the stomach, the hydrochloric acid starts to break down all the foods that you've just eaten. As it makes its way to the duodenum, the pancreas knows what enzymes to put out, the liver knows what enzymes to put out to break down the rest of the food, the small intestine absorbs everything, sends it to the liver. So everybody understands how everything goes to the liver. All right, this just is a general what happens in the liver. Table sugar. The white table sugar. Does it have fructose in it?
No.
Yes.
Oh, it does.
Okay? So you have sucrose binding with fructose. Okay? Now, what's the difference between this fructose and fructose corn syrup? This is natural, and this is genetically modified and unnatural. All made in the lab. And ironically, you know who funded it? The Post brothers from Post cereal. Can you believe it? Because sugar was too expensive, is what the determination was. Fructose corn syrup is cheap to make. It's 50 times stronger than sugar. Okay? But once again, the body's mechanism of perfection binds ingredients based upon the charges, positive and negative charges. So table sugar does have fructose in it, but it's natural. And it's something like 70% sucrose and 30% fructose. So if you ever hear people say, oh, there's fructose in that, that's true. Your body breaks it down, and there is a binding of the sucrose and the fructose, but it's all natural. Does everybody understand? Does everybody understand the concept of receptors? What does that mean? Here's a cell, nucleus in the middle, and cytoplasm all the way around. Okay, that's a normal cell. Cell has a two outer coating. That's just my bookie for the game. Sorry, guys. All right, so how does the substance get from outside to inside? And that's where we get into receptors. Okay? Example is sodium and potassium. They go back and forth through the cell, but they need a receptor to get in. Sugar needs a receptor to get in. Everybody understands the concept. There are receptors that bind to the chemical to get into the cell. So everybody keep that in mind. When we eat, we'll still put the same thing. Liver, okay, we'll draw the pancreas, small intestine, and then the colon. Okay? When we eat natural food, there are no receptors specifically set up for those natural foods in the body. Does everybody understand that? In the liver, there's a receptor for fructose corn syrup. You have to understand this concept, guys. So this ingredient that's put in everybody, any box of cereal, sodas, children, remember that? The fructose corn syrup has receptors in the liver that no other sweetener has. And what does it do? When it binds to that receptor, so you eat the fructose corn syrup, when the fructose corn syrup binds to that receptor, what does it do? It increases what's called gluconeogenesis and the production of triglycerides and cholesterol. What do we know about triglycerides and cholesterol? They're not good for the bloodstream. They're not good for blood vessels. So what do we find that fructose corn syrup does? It causes, listen to what I'm telling you and read the articles, it causes heart disease. All right? And again, guys, the only reason we're talking about it today is to get everybody you know aware of all this stuff because it's happening in children. That's what's so frustrating, that this is so out of control that the children are ending up with coronary artery disease. The children are ending up with kidney disease. The children are getting on dialysis. It's out of control. And you'll see they put the dangers in the article from the Cleveland Clinic. So what do these do? The gluconeogenesis, the triglycerides, and the cholesterol. What happens now is you're building up because the liver, we'll draw the liver again. The liver now becomes a warehouse for fructose corn syrup. And what happens? You get a buildup of fat. So you actually see on a CAT scan, an MRI, pathology, when the person passes away, you can actually see fat globules all over the liver. Never seen. Never, ever seen before fructose corn syrup. Follow me? Some people did have fatty liver from the fact that they were taking in too many sugars and sweets and no exercise. And that would be the stories you hear about the 600-pound patient. So aside from the morbidly obese patients, we never saw this till the 80s, okay? And if you go back, the data shows the first report of non-alcoholic liver disease causing fat was in 1856. So you can follow it back, but you look at that person and they just had poor dietary habits, and they became extremely obese, didn't move around. That's what led to the fat buildup. So it wasn't like we didn't have fatty liver, but the percentage of the population was less than 1%. It didn't get to the point where we started collecting the data till probably 85, 86. And since then, there's a tremendous amount of data that you could read about. And I'll give you all the sources, okay? So back to, what does it mean? Okay? Now that we have genetically modified fructose corn syrup, two things. First, the corn is genetically modified. I think that's coming up in April. We're going to talk about the modified ingredients and ultimately what happens when you genetically change. Here, I'll give you an example. Wheat. In 1896, wheat had 14 chromosomes. It now has 40. And everybody heard of Roundup? Kills weeds. You can spray Roundup on wheat. Won't kill it. Okay? Do you think that's good or bad for our system? It's a whole other topic. We'll talk about it in April, but my whole point is that the genetically modified ingredients coupled with the outcome that leads to these mutations is for the purpose. What's the purpose? Well, if you can squirt it with Roundup and it doesn't kill the wheat, obviously it's there so we can grow more wheat. But what is the byproduct? We don't metabolize it. And so that metabolism breakdown leads to the bloating and it leads to problems. So we genetically modify the corn, then it has to be chemically manipulated. What does that mean? That means you take that ear of corn and you chemically manipulate it. What have they found in fructose corn syrup items consistently in America? It'll be in the article by Dr. Hyman from the Cleveland Clinic. Mercury. And then they put it on a spectrometer, spectrogram for those of you chemists out there. Any product out there you put through and it helps you figure out what it is. Our scientists can't even figure out 10 of the substances in it. So this genetically modified corn that leads to fructose corn syrup has mercury, and it's been identified on shelves in grocery stores. You know, you mentioned like the Hershey sauce. The one article I read was done from Princeton, and they identified mercury in 10 different stores that they went to with products of fructose corn syrup. So once again, guys, these are the dangers. So we're taking the corn that's been genetically modified to be grown, we're putting chemicals in it to manipulate to get the maximum amount of fructose. And again, it's 50 times stronger than regular, I'll put table sugar. And we find it's addictive. They're talking about similar products. We all know alcohol is sugar. Or if you didn't know, it is. And alcohol can become addictive. Why? When the level drops in your system, you want more. Same thing's happening with the fructose corn syrup. As you eat what you eat and the fructose corn syrup levels go up, now as they're coming down, you crave that fructose corn syrup. Just like you crave the alcohol. Even you crave the sugar. All those products are marketed as if they're perfect and fine and they won't hurt you, but the person that chemically modified all this knows what's happening. That's why they call it the dangers, guys. All right, so let's go to what do we know about it? We know that the fructose corn syrup causes inflammation. Please read the article. It's real easy, guys. That's why I'm pushing this one of Dr. Hyman's from the Cleveland Clinic. It'll take you 5 minutes. You don't have to be a doctor to read it. It's very simple to understand. Okay? And the inflammation, it is scary, but the terminology is leaky gut syndrome. The fructose corn syrup causes leaking within the small intestine. Remember I said 150 feet? And that leakage leads to inflammation. And we've talked about inflammation before. Inflammation can lead to cancer. So we know the fructose corn syrup can cause the inflammation. We know that inflammation in a blood vessel, especially since you're also increasing the triglycerides and the cholesterol, coronary artery disease. And again, read the articles, because the part that blows me away, because I remember when it happened, I was young enough, the big gulp. Everybody seen the big gulp? You know, it's at one of the stores, I forget which one, it might be BP, gas station. So you go in and they have 4 cups. And one's maybe 20 ounces, one's maybe 30 ounces. The big gulp's 64 ounces. And it's only $1.09, okay? So you fill up. The fountains are the worst with the fructose corn syrup. So you go in there and get 64 ounces of that, and you can refill it. So that's the kind of things that are happening with our children. That they think it's great. They're going in, they can refill it for nothing. They get 64 ounces, so now you're getting 124 ounces of it. And again, it's dangerous, and it's cheap for them. So look at the concept, okay? But remember, this is one of the things that's proven, that the blood vessels with increased triglycerides and cholesterol leads to coronary artery disease. The second thing that's known is diabetes. And again, guys, just real look at the articles, because it does better than I can. But it shows this is per 100,000 people. And back in 1980, the line went something like this. And this was all type 1 diabetes. So we put diabetes 1. Now, it's ridiculous. It's up into like 800,000. And now we see it type 2. And how do we develop diabetes? Fructose corn syrup makes the body's insulin resistant. What does that mean? That means that when you eat things and your sugar goes up in your body, your pancreas produces insulin to bring the sugar down. Fructose corn syrup in your body with the inflammation leads to resistant insulin. So your body produces it, but it's not lowering the sugar. Does everybody understand that concept? That's how we're ending up with kidney disease and dialysis in 15-year-olds in America. 15, 1-5. Absurd, guys. And you're going to see Cleveland Clinic knows, Mayo Clinic knows, all these places know about it. But the lobbies are so big that no one can do anything about it. But it's ridiculous. And again, this is how it works. The insulin resistance leads to the diabetes. And remember what we said about the fructose. Once the level starts to go down, you crave it. Okay, you got it? Third one. Cancer. GI, GU, skin, lymphoma. Number 1, GI. Number 2, kidney. Number 3, melanoma, and all types of lymphoma. Proven. Read the articles. They're looking at the data. What does it cause? Because it leaks through your gut, it starts inflammation. Inflammation in the body is not good, especially if it's chronic. So that chronic inflammation, depending on what part of the body it hits for you, causes a mutation. Once that mutation occurs, cancer grows. And it's proven, guys. That's why I'm talking about it today. This isn't just a concept. I've talked about fructose corn syrup for 20 years because I've heard the bad things about it. The data's out. The one article's from December 1st, 2020. The other article's from, I think it's January 15th of 2017. This is legit. This is real. You got to pass this along. Okay, so because of the fact that it can be cancer causing, I would say if you have a high fructose corn syrup ingestion, I would definitely get cancer screening. What does that mean? There's blood tests out there now. There's blood tests out for breast, there's blood tests out for colon, there's blood tests out for skin. You know, these are things that can't be done. Just talk to your PCP. Once again, if you're not using this stuff, like if you don't eat or drink any sodas, you don't eat any cereals that have sugar in them, you know, if you're not reading labels, you don't know, so you have to read your label. And everybody thinks they don't have it, so open up your refrigerator and look. Because I was shocked, you know, because these are brand names. Heinz. Heinz is like a product in Pittsburgh forever. Heinz ketchup has fructose corn syrup. That just blows me away, but it's fact. So you have to look at every product. Mustard, even mustard has it, certain types of mustards. Mayonnaise has it. You have to look at the back, because it has to list every ingredient. Every ingredient. And now the new thing, there's different terminology coming out. They'll just say corn syrup. They won't say fructose corn syrup. And another one says maltodextrin. And you read in the article, the doctor says, if you don't know that word, don't put it in your system. So maltodextrin, what that stands for is corn syrup. But you don't know that. So they're even now changing the names on the ingredients and getting away with it. So please pay attention. And again, the cancers come because of the inflammatory process. The inflammatory process, please at least read the Cleveland Clinical article by Dr. Hyman. It's real short, and you'll see all this stuff I'm telling you. He just throws it out as facts. Like, these are the facts. This is what's going on. And again, the inflammation leads to the mutation that leads to the cancer. Now, what did I tell you earlier? Are we all doomed and gloom? No. Read the label. Don't take it in. You don't have to take fructose corn syrup in your diet. You do not have to have fructose corn syrup ever. So this isn't doom and gloom. All it means is read the label. Hunt's ketchup doesn't have it. What's the bread? All bread has it, except for a lot of the Italian ones that, like, I think Mancini's doesn't. And then there's one, I think it's Schwabel or something like that, doesn't. Other than that, all bread has it. It's everywhere. So read the label, make sure you're not getting it, and you're fine. I told you we can reverse it, and we'll talk more about that. But once again, what you have to understand is this when we look at the cancers, okay? The inflammation leads to the mutation, leads to the cancers. And once again, if and only if. I don't want you going to your doctor and saying, I just was at a lecture and he said I'm at risk for cancer and I want to have all these cancer screens done. But if you tell your doctor that you're eating or drinking X number of substances that have a high fructose corn syrup in it, you just put that down. Everything needs an ICD code today. You know, they beat me up about a month ago. I think they said the law changed in September. When I write a prescription, I write the patient's name, I put the birth date, I write the prescription. Now we need the address, we need the patient's birthday, and you need an ICD-10 code all the time. And I have a flip-top phone, so I don't have a good shot at doing it, so now they make me carry the other phone, so you have to look it up. But again, guys, it's just all these changes. They're making us change and jump through hoops here. And believe me, everybody in the Senate and everybody in the Congress know this. Everybody knows this. Because these lobbies pay these guys off, and girls. All right, so everybody understands the concept. All right, now, the other one that's big, and you may have read about it, what's the fourth problem related to fructose corn syrup? And for those of us here that can remember, I grew up with my grandparents. And every Sunday we had like family get together. And friends would stop as well as family. And I come from a big family. So there was usually 150, 160 people there every Sunday. And I don't remember any senior that said they didn't remember. Or any senior that was demented. You know, I remember Aunt Jenny, she put a little bit too much vinegar in, and she forgets what she put in, but that was Aunt Jenny. You know, she knew money, she knew business, she had apartments, she collected rent. I never saw the kind of dementia that I'm seeing in my practice today. And I spent a lot of time, I grew up on a farm with my grandparents and every Sunday, 160, 150 people. And of that, probably at least 30 to 40 people were over 80 years old. And I never saw memory problems. Now, is that just isolated me? No, it's proven. Fructose corn syrup causes dementia. For those of you who haven't heard about it, they're going to start calling it diabetes type 3. And if you haven't heard that expression, then I'm the first to tell you, but you're going to hear a lot about it. And at least they're doing things to prevent it. So you see all the different products that are out on the market and everything that's going on, all the substances, take this, it'll help your memory, etc. Get rid of the fructose corn syrup. Is it completely reversible? No. Is there some reversibility? Depends upon how early it is with you. But it's something that you have to pay attention to because it's real. And again, how does it happen? Inflammation. And then imagine, if you haven't done it, for the heck of it, do it. Put some sugar on your table. Put a little, say a teaspoon. Take a teaspoon of sugar, put it on the table, and put a dropper of water half an inch away. And the water will move to the sugar. Takes about 30 seconds or more. Watch it. It'll move to the sugar. Then the other thing you want to do is put your fingers in it, and this is table sugar now, not fructose corn syrup, and push it around in your fingers, and what happens? When you open up your two fingers, they're sticking together. Does everybody understand that concept? Fructose corn syrup is 50 times sweeter than sugar. Sticky. Does everybody follow me? In the bloodstream, it's sticky, getting into the brain. And what do we know about dementia? Neurofibrillar tangles. I have a hard time saying fibrillar. How's that sound? Okay. These are fibrils that from the main nerve send the signal through your body. Sticky. Does everybody follow the concept? Over time, those tangles occur and the signal doesn't make its way down. Is it reversible? There's current research is showing the reversibility. So again, guys, please pay attention to the fructose corn syrup and dementia. And you know what, I was amazed? I did my own study. I see a few patients on Saturdays. That's a joke. Say like 20, okay? And what happened was, I was just curious. My curiosity started years ago. I was at a friend's house for 4th of July picnic. And what he always did was he had a 2-car garage, and he took the cars out and he put those metal tubs of sodas, and he put the name of the soda. And for the heck of it, I went around because I wanted to see which one had the most sugar. I'll give you 3, you pick. Mountain Dew, Pepsi, Orange Crush. Which one has the most sugar? Everybody thinks Mountain Dew, right? Orange Crush. You follow me? Like, it just blew me away. But the concept was, how many people drink fructose corn syrup sodas daily? I was shocked. Over a 3-month period, it came out to be almost 100 patients, like maybe 92. 60% of my patients are drinking soda weekly. And I'm not saying that's bad, guys. I was just shocked. Because when I was growing up, my grandparents wouldn't let us drink that stuff. And they never drank that stuff. But what I find is, like, it's refreshing. That's what some people tell me. What's another word? Refreshing, tastes good. I just like to drink it. And believe it or not, a lot of people drink the popular brands, like the Coke and the Pepsi, and those are the highest in terms of the fructose corn syrup. And once again, I'm thinking I'm just telling you to get rid of your salad dressings and get rid of your Heinz ketchup, and then I find out that a lot of people drink sodas. And then the other thing I found out was that same group of people, 30% of them eat sugar cereals every morning. Shocked. Again, that's why we're talking about it, because it's fructose corn syrup. Just read the box. And that's what bothers me. Candy, sodas, cereal, children. That's my frustration. We shouldn't see 15-year-olds on dialysis. We shouldn't see liver transplants being the highest right now, secondary to sugar intake. But that's what's happening. So please pay attention to it. All right, now with the dementia, the reversibility. I'll put it out there just so you see it. Nicoderm, 14 milligram patch. Remove all fructose corn syrup and no genetically modified. The study's going on right now. And my partner, Dr. Jagiello, is involved with it. It's being done with the Butler Med, M-E-D, med beds. For those of you who haven't heard about med beds, there's crystals in Africa that give off what are called photons. And photons are in everybody's body. And the photon has the ability to energize your cellular activity. And that cellular activity is what's called the mitochondria in the cells. And they're seeing results with Parkinson's disease, they're seeing results with dementia, they're seeing results with bad inflammation. How I got to it was Dr. Jagiello, my partner. We play soccer on Sundays, and we're getting older. So he ended up hurting his hip. It's called the labrum. He tore his labrum. So he called me up because he rounds at Passivant. He says, hey, I'm gonna need someone to cover me at Passivant because I'm gonna have the surgery done on my hip. So I said, okay. So I call him up to say, hey, give me those dates. He goes, oh, I don't need it. And I go, what do you mean? He said, I went to the Tesla Butler med beds and I bought the stuff. I go, what stuff? And here he got better to the point he didn't need surgery. And Ben's cheap. He's cheap. Like I thought I was cheap. Ben and I've known each other 40 years. He's cheap. And he spent $25,000 on this stuff. So it's for real. But the whole point I'm bringing it up for is they're looking at med beds, the Nicoderm patch. They say the nicotine puts more blood to the brain and it has a positive effect on the memory. And what he's seeing with it is he's put this no genetically modified, no fructose corn syrup. You cut the 14 milligram patch into quarters and you put a quarter on a day. And as long as you avoid all this stuff, early dementia. This isn't gonna take somebody that's had dementia for 20 years and turn it around. But he's seeing positive results. And they're doing the study out at the Butler Med Beds. And if anybody's interested in that, you can Google it and find the information. It's called Butler Tesla Med Beds. It's an old hotel they converted in, and I've been there. I went down to check it all out and see what it was all about. And when I saw Ben spent the money, I knew it was for real, you know, because he didn't want to have the surgery, I knew that. But we played soccer last Sunday and he's running around like he always did. So once again, guys, please pay attention. I'm not giving you all doom and gloom, I'm giving you facts. And then I'm telling you this stuff is all reversible, but it's up to you. And please, please look today. Please look in your refrigerator. Look in your pantry where you have canned goods. Read all your canned goods. Read all your products that have ingredients listed on there in the pantry. And then please open up your refrigerator. Take out, not all mayonnaise, I think it's Hellman's, I think that's the one they said. I don't know all the names, but you make sure you take a look for yourself. Because what they say is 80% of us are using fructose corn syrup daily and we don't even know it. 80%. And it's affected over 100 million Americans. That's a lot of people. A lot of people, guys. So again, what I want to make sure everybody understands, fructose corn syrup that's genetically modified with chemicals that we know include mercury. Look up the Princeton study on fructose corn syrup. I think they were seniors, and they went through a bunch of grocery stores, and they found all this data. And again, it's been out for years, guys. That's the part that's so frustrating. So look at that, because this is a fact. It's genetically modified corn that makes the fructose corn syrup after it's chemically manipulated, and mercury has been identified as part of those byproducts. It went into the spectrogram and they couldn't identify 10 products. So this stuff, our experts don't even know 10 of the substances that are in it. What does it do? It binds to a receptor in the liver, and it causes gluconeogenesis and increased triglycerides and increased cholesterol. It is addictive, just like alcohol. And the cost, staggering. You can't imagine, guys. I remember when it happened. I think I was new, say 90s. In the 90s, Medicare started providing care to dialysis patients because there became too many of them. I didn't know to do the dive to find out why back in the 90s. All I knew was that came through the AMA stuff that we get, that now dialysis patients, no matter what the age, are going to be on Medicare. And now what I see is children, 15 on dialysis. It's absurd. But the big goal, they claim of all the food products out there, the sodas are the culprits. And the fountain sodas are the worst. And so if you go to a drive-through restaurant of any kind, you're getting a fountain soda. So please pay attention to it. Get a water. They can all give you a bottle of water. But please pay attention to it because it's for real, okay? So this is just a general take a look. Now, let me tell you the good news. I was telling you about 50 people, 50 plus. Zach, I'm not supposed to use his name, but I will anyhow. My wife calls him her fourth son. We have 3 sons. All my boys live away from home, but Zach lives right up the street. So Zach's the guy that does everything at my house, okay? So he comes in to see me it's probably been about 5 years now. He comes in to see me 5 years ago. He's 6'2", probably about 250, and he said his triglycerides were over 300, and his cholesterol was 250. His mother's a nurse, and said, "You're gonna die." Scared the heck out of him. So he came to see me. So we worked him up, and that included a CT scan of his abdomen, and he had a fatty liver. He was drinking the beer that had fructose corn syrup in it. He was usually his morning routine when he went to work. He went to McDonald's, got 2 sausage McMuffin with egg, and he got a soda with it. At lunch, 2 sandwiches from McDonald's, soda. Dinner, same kind of thing. Fortunately, he got married, and his wife cooks all normal foods. She doesn't do any of those foods that are already homemade. And what I did, I was at my office. My wife, we have 6 children. After each child, she got a piece of equipment to lose weight, okay? Well, the equipment's still brand new, okay? So I have it in my Bellevue building, and that happened to be where I saw Zach. So Zach was panicking. So he said, "My mother said I'm gonna die from heart disease, da, 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 da." And I said, "You have fatty liver." "What does that mean?" and I kind of gave him a little synopsis of what we just talked about. Well, what can I do? I said, we have to stop all sugar. You got to get yourself on an exercise program every day, and no fructose corn syrup. And he never even heard of it. He goes home, looks in the refrigerator, looks in the pantry, everything had fructose corn syrup. I'm happy to say, Zach, well, he's only 6'1" now, because we just saw him about a month ago. 6'1", he's down to 180 pounds, and his liver has no fat around it whatsoever. And he drinks water. He quit drinking the beer. That's mostly because he had a baby and his wife wouldn't let him drink anymore. But still, he doesn't drink the beer anymore. But as it turns out, that was one of the cases that I thought was so good, because he exercised every day. The bike I gave him had things that move the arms when you pedal. So once he got better, he brought the bike back. Okay? So another patient, I'm amazed at what they can consume in a day. This guy works down at the jail, and he would drink those 2-liter bottles, 3 2-liter bottles a day. And when I talked to him about it, he goes, all we do is sit around. Once we do our checks, we just have to sit there and watch the monitors. So no exercise, 6 liters of soda, and his soda of choice was Dr. Pepper, which also has fructose corn syrup, and morbidly obese, fatty liver. He got the bike. He does no more. He drinks beer still, but he doesn't drink the beer with fructose corn syrup in it. And I had to laugh because his father's also my patient, and one day his father and I were out, and we stopped over the house. He brags about his chair in his man cave. It can hold 12 cans of beer in its refrigerator. So they're moving on up with those chairs. But again, guys, please understand, these are the positive things, that you can turn it all around. Please, what I want you to do today, okay, is check your refrigerator, check your pantry, and please read labels. It'll say ingredients. And it lists from most to least. So you'll find that whatever that product happens to be, when you turn it over and you look to see the ingredients, it'll give you a report of sugar and all that kind of stuff. That to me isn't as significant as look at what the ingredients are. And if you can't read what it is, don't take it. And if it says corn syrup, fructose corn syrup, don't take it. If there's a GMO, because they have to put, if it's genetically modified, it has to be on there. So if it's a GMO fructose corn syrup, please don't take it, okay? Now, what I found was, with my patients that I told you I was talking to, what I found with them was they went to water, and one of them, it's called cucumber, I can't spell it, cucumber. She brought the bottle in. It was like a yellow bottle and a big C on the top. And she had me taste it. It wasn't bad. Like, I don't like the lime in it. I don't like something. I can drink regular water. But this just had cucumber in it, and it was amazing. It was actually refreshing. But my point is, switch your beverage. It's so important. If you're a tea drinker or a coffee drinker, read the stuff you're putting in. The stuff you put in for milk has fructose corn syrup in it. You read the label, you'll be shocked. Especially the ones that have like French vanilla and all those different kind of things. Read the label. Genetically modified, fructose corn syrup. So please pay attention to that. Switch to water whenever you can. If you're going to drink caffeine, what do you put in? I forget the one that was the most common. I can't think of it right now, but it was the most common one that I did with my group. And I would say probably 60% of the people drinking tea or coffee put some kind of creamer into it. And that creamer can have fructose corn syrup. So you have to pay attention to that, what you put in. Now, when it comes to food, I think you guys should be good here, because I hope that they're cooking everything that's fresh. Okay? If you have food that's pre-cooked, read the label. Because why else do they put fructose corn syrup in things? That's what they say it's in the beer for. Because it lasts on the shelf longer. I know what it was. Have you ever seen green bread?
What?
Green bread. Like white bread have a little green thing in it. Okay? My father used to joke around and say, eat it, it's penicillin. Okay? But what I found out, that's what the fructose corn syrup turns green. So if you look at your bread and you see a green, I've seen it. Yeah, I think we used to use Wonder Bread at home. And I can remember seeing it. So please pay attention. Even bread has fructose corn syrup. All right? So read the labels, look at the foods, and then remember, if you or someone you know has trouble with fructose corn syrup intake, talk to the PCP, because they are allowing you to get a cancer screen. Okay? Dementia screen, it's called the mini mental. Everybody has it memorized. They're changing it around now. They don't ask you pen, tie, and watch. You know, it's a little bit more involved, and it's something that you should do to see how your mind is. Pay attention to that. But make sure that if you think, and what I say, if you're taking it in, if every single meal you're having a soda, that you're taking in a lot of fructose corn syrup. And that would be justified. You talk to your PCP, they can code it so that you can get a cancer screen. And it's head to toe. You know, these are all blood tests too. It's just blood tests that you get. And this will show if you have a genetic predisposition to any of these cancers. And if you're taking in that fructose corn syrup and you have a predisposition, then you got to realize that it's a dangerous situation. You got to stop the fructose corn syrup. Please pay attention to that. And then the last thing I'll leave you with is treatment. When the fructose corn syrup gets so high that there's fat around your liver, it means that you're in danger of what's called cirrhosis. What does that mean? The liver is very bloody. Remember what I said? The portal vein brings everything you just ate into your liver. So there's a lot of blood in the liver. And they're called sinusoids. That's where all the main parts of the liver function to detoxify everything. When the fat builds up on the outside and the inside of the liver, it pushes the architecture of the liver together. And if they touch, they become fibrotic. What does that mean? That means the liver doesn't work there anymore. And so we can get away with parts of your liver not working, but if you keep up the fructose corn syrup and more fat accumulates, that fibrosis leads to what we call cirrhosis. And the first time ever, we now are seeing, instead of alcoholic liver disease, fatty liver has taken over. There's more fatty liver cirrhosis than alcoholic liver cirrhosis in America. And that, guys, is staggering. Why? Because it's children. And look at what we've seen in our lifetimes. Look what we've seen with healthcare. And what do they tell you all the time? It's because of the cost. Well, children getting dialysis at 15, that means the rest of their life Medicare is paying for that. And if they're getting it at 15 because they're eating the fructose corn syrup, and we're not getting the fructose corn syrup out of the sugary things that they eat every day, it's only going to get worse. So please, please, please pay attention to that. Okay, guys, I was on time. Ooh, and I'm quitting on time. Look at that. Today's a good day. I'm going to put these two names up here so you guys can look them up. And then, any questions? I'll answer any questions anybody has. Yes?
That Dr. Hyman from Cleveland Clinic.
He is.
Spell his last name.
Hyman.
Okay.
Is he on TV?
I don't know.
I think
he may be dark-haired guy. They had a picture of him in the article. Dark hair. He had dark hair and he wore dark glasses in the article.
But I remember the name on TV, a special show.
Yeah, Hyman. Okay, so Dr. Mark Hyman, and that's the Cleveland Clinic.
Can you buy a book or anything?
I would say read the article and then they'll show you at the bottom of the article what you can do. Okay, and the other guy's name is, I wrote it here someplace. All right, Dr. He just gave me a J. J. Nico. Plant. Antonio. And this one was the Mayo Clinic. And then I'll give Karen the other articles that I used for the talk. Because again, guys, the thing that blew me away was the leading cause of liver transplant is fatty liver disease. I can remember when I did the transplant, the patients, if they had alcoholic liver disease, they had to be off alcohol for 3 years before they would allow them to transplant. So there were stringent rules because there's not that many livers. And now when you have children in those rules now taking those livers, it's just crazy to me. But please read. This one's so simple. Get this one, guys. And I'll tell Karen because I have all of them. But that one is very simple, real easy to understand, no big words, big terms, cuts right to the chase and tells you about it. And the statistics, they're just frightening. 100 million people, and they're saying that the fructose is an epidemic. They're using danger word, got me, epidemic, got me, and dementia, diabetes, cancer. You think of that. Those three things are the drivers of cost of healthcare. Those three things. And this is a direct cause of all three of them. And it's been the standard sugar in America since 1983. To me, guys, that's absurd. But you can't fight City Hall. I don't think there's anything we could do to turn it around tomorrow. But what you can do is stop taking it in and reverse it. And remember, just walk. You don't have to sit and be fit. I've done the sit and be fit just because I one time told a patient, it's a waste of time, and I got sweaty doing it. So it definitely is exercise. So you can sit down and do exercise. There's many ways to burn off the calories, many ways to burn off the fat. But the thing you have to stop is the fructose corn syrup. And the only way to stop it, check your pantry, check your refrigerator. And I would say talk to the people here, but I'm sure that, I hope it's all natural. My thoughts would be that they're not using processed foods to feed you guys every night. But that's where they say 600,000 products that were reviewed in the Mayo Clinic study from 17 had the fructose corn syrup. That's ridiculous. And it's on every shelf in every store, and no one's hiding, no one's running from it, no one advertises it. But the good news is every single canned food you want, any single, added like ketchup, mustard, any salad dressing, and any barbecue sauce or whatever, you can get without fructose corn syrup. Just like I said, you can get without fructose corn syrup Hunt's ketchup. I checked it. So it's all, wherever you're shopping, you go to the shelf, and it's probably gonna cost more, everything does, but you can see with whatever you're looking for, turn it over, read the label, make sure there's no fructose corn syrup. And again, guys, please pass it along. Friends and family, talk about it, because this is ridiculous. And especially now, I'll let you know, we'll do the talk, I'm pretty sure it's in April, because I'll have the data coming back from the med beds in Butler. And I think you'll see that it's gonna be good news, that it sounds wonderful with what I'm seeing. Again, it has to be early dementia, but that nicotine patch is definitely working. And of course, you gotta avoid GMO, and every label has to, if it's genetically modified, it has to be on the label. So look for GMO. Most corn has it, so for those of you guys that like corn, read the label. I haven't found any yet that doesn't have it. You know, and then I even heard it's in the corn that's grown. You know, they say local, what do they call that one local? Evans City. They say Evans City isn't. Other than that though, supposedly most all corns that we take in have fructose corn syrup. Please, please, please pay attention, guys. Good. Are you sure there's no questions? Yes?
How come I never got a liver test, fatty liver test? The doctors give them?
No, I don't give them unless your enzymes are elevated, because once the fat goes around the liver, then the enzymes in the liver will go up. You know, so if I don't have abnormal liver tests on the patient's blood work, and talking, I asked them,
Medicine and everything.
well, that doesn't necessarily mean it's fatty liver, so check with your doctor, you know, but I check with people, always ask patients what they're eating, breakfast, lunch, and dinner, you know, and I find that if you're taking in a lot of sodas, a lot of sweets, those are the things that put you predisposed. But overall, it's not something just to check everybody's liver with the CAT scan.
Could I ask for one?
If you can, sure, you can definitely ask and tell them that you heard the lecture about fatty liver disease and you haven't been watching fructose corn syrup, and they may be able to get it for you. All depends on your insurance. Any other questions, guys? Good. Hey, and I was early. Leaving you 5 minutes late, but I was here on time.